Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
I started at the county in 2004. Prior to that, I was at Long Beach Memorial Miller Children's Hospital, where I did pediatric infectious diseases in the hospital and as outpatient clinic as well. And while I was doing that, I also coordinated the full flu surveillance for the state of California. When I was a child, I always loved children. I was fascinated by babies. I loved to watch them grow and develop. So even as a 5-year-old, I wanted to be a pediatrician. And then when I went to medical school, I learned about different diseases and organisms and how they cause diseases. And I became especially interested in infectious diseases. And that led to my further doing a fellowship in infectious diseases. For the clinical side, when I do pediatric infectious diseases, we see patients in the hospital who have infections or are being ruled out for infections. So it's really a consultant service where the general pediatricians and hospitalists will ask for our opinion and our advice. Here at the health department, I serve both as a medical epidemiologist and as a pediatrician. For the medical epidemiologist, we're studying different risk factors for disease, doing surveillance, investigating outbreaks of communicable diseases. And then on the pediatrician side, I help with public health emergency preparedness. I chair the Kids in Disasters Working Group for the county, where we work with the community partners to make sure that the needs of children and infants are accounted for in our preparedness plans. So I think a lot of people think healthcare agency, we only deal with doctors or healthcare facilities, but really we're out there trying to educate, as I said before, childcare, schools, businesses, city emergency management on the health issues, as well as public health emergency preparedness. So we started the Orange County Kids in Disaster Working Group in 2012, and it's under the Operational Area Disabilities and Access and Functional Needs Working Group. And the reason why we started it is we noted that the planning for children was often an afterthought. We needed to do specific planning to address the needs of infants and children before, during, and after disasters. And when we look nationally, in a survey that they did, only 1 cent out of every $10 of federal emergency preparedness money was spent on children's safety, whereas children actually take up 25% of our population. And children have so many needs. They aren't small adults like people often think about them. They have different physiologic needs, medical and psychosocial needs. They're dependent on adults entirely when they're young, to be fed, to know who they are, where they are, that we really need to spend more time educating people and including children in our plans. When we look at nationally also, when they did a survey of people and whether or not they were prepared or not for disaster, only 57% of families were prepared. And a lot of them actually thought that help would arrive within just several minutes of when they needed something in a disaster. So we obviously have a lot of work to do educating people in the community, as well as our emergency planning partners, of the need to ensure that our families with children are prepared.